I'm very delighted. I want to bring Kristin Rice on. Kristin Rice, for those of you who attend the support group, know that she's amazing. And she's been participating and being very proactive in her care. Kristin Rice has been a lifelong kidney patient who is currently on peritoneal dialysis. She's been an active member and volunteer since 2020 from us. She jumped on board when we all started on Zoom. Kristin is married and has a daughter and two fur babies. And she works full-time as a change manager and enjoys helping people talk through various challenges and changes that come with managing CKDs. So I'm very excited to have Kristin with us today. You want to let's pull up Kristin so we can see her before we bring up the slides. Yes. So thank you, Kristin, for being here today. And I'm going to turn it over to you and you can share your story.
Thanks, Lori. I am honored you chose me to be one of the speakers here today. So let me share a little bit about my experience managing kidney disease. So a little bit about myself, like Lori said, I'm married. I live in Maryland. I have a husband, a daughter, and two fur babies. I'm a lifelong kidney patient, and I am also a working mom. And here are some pictures of my family for effect. Cute daughter, cute dogs. So much like Lori, I am a lifelong kidney patient. I was diagnosed as a toddler, and living with this condition is all I've ever known. So as a pediatric kidney patient, there was probably a few more hospitalizations, like Lori said. I was a kindergartner on blood pressure medication, but other than having more doctor's appointments and some dietary restrictions at an early age with sodium and protein and kidney things, I lived a very normal childhood. I was an athlete in high school. I was an athlete in college. I went away to college. I did all the things. My kidney disease early on in life did not stop me from doing anything. It was just something that my family managed and we cared for with quarterly appointments and prescriptions and the like. In fact, most of my family had either forgotten I had kidney disease, and my friends didn't know I had kidney disease until I got into, my mid to late 20s, and my husband and I started talking about starting a family, and we chose to go the adoption route because I was advised that getting pregnant could have hastened the decline of my kidneys. So it was really a choice I made with my medical team at that time that, not to get pregnant. I think if I had decided I wanted to get pregnant, they would have been supportive. But ultimately, in talking to my husband, we felt we were two people who wanted to be parents. There were children out there who needed homes. And we chose to go, the adoption route to start our family. And I think anybody who knows me knows my daughter is my everything. And in the universal scheme of things, I fully believe one of the reasons why I even have kidney disease is so that my daughter, who was adopted from China, and I could be together from across the world. So, that aspect of things ended up being a blessing versus what, something else it could have been, right? So over the years, my kidney function has steadily declined. As I went along, I started developing anemia, which is another common symptom of kidney disease. I had to add potassium and phosphorus restrictions to my renal diet, which is common as things go along. My glomerular filtration results dropped down to 20%, which is the magic number for qualifying for the transplant list. And at that point, dialysis also started looking like a real possibility for me. And that was when, like Lori said, I felt the need to really connect with my kidney kin. I'm a planner. I had done my research, learned about peritoneal dialysis, looked at the dialysis resources, talked to my doctors about it. But what I was lacking was that insight that comes from talking to other patients, other people who have been there, done it, got the t-shirts, lived with all of this, and really managed the condition. So that was when I found RSN, because I was looking for that patient perspective and I was looking to make connections with other people who had lived through dialysis, had taken different approaches to dialysis. It was also a great way for me to connect during COVID. So I joined support group. I started off as a lurker, listening in, learning from the experiences of others and what they had to say. Over time, I started getting my bearings, feeling more comfortable in that online group setting, becoming a more active participant, and sharing my experiences as a lifelong, kidney patient, recognizing what I could offer to other kidney patients from my experiences, and becoming more outward in my sharing. And then over time, that's progressed. And I was lucky enough that Lori asked me to get more actively involved with the group and become a facilitator to even further help people managing this condition and sharing their experiences. So one of the other interesting things, though, that I got from looking at the RSN resources on their website, being an active member and support group, was really the courage to share and to be my authentic self. Like I said previously, my kidney disease was something I never really spoke about publicly. My family knew about it. It was kind of in the background because here I was living a very active life, doing all the mom things, the work things. And it was just something that nobody really talked about. At work, I certainly wasn't talking about it. I wanted to present myself as the professional that I am and the hard worker and not have that be part of my identity. But as my kidney disease progressed and the need for transplant really became more of a when and not an if, I felt like I had to start putting myself out there more and being more of my authentic self and really getting the word out there that I did need this transplant and looking for help and looking for a preemptive living donor. And RSN and the connections I made in support group really gave me the courage to have those conversations. It gave me the language to have those conversations. It gave me the resources to have that conversation, and just tapping into the experiences for others, or how I could go about putting myself out there as my authentic self, as a person living with a chronic condition, to go about making this big ask for a living donor and sharing this vulnerability I had with others who might not have ever seen me in that light. So I go into the start of 2023 and I'm being proactive. I'm telling my story. I'm looking for a living donor. I'm also having conversations with my medical team, and I am very lucky. I have an amazing team of doctors and nurses who I can have open conversations with. One of the conversations my nephrologist and I started having was around looking at my labs. Okay, now I'm hitting the 15% mark with my GFR, which is typically the magic number for dialysis, give or take. So because I have a great team and a great relationship with my doctor, the conversation was, I have these milestones coming up later in the year around my daughter graduating from high school, going off to college. Can we put off dialysis until the fall when all these things have transpired? And then I will have my head around the idea of starting dialysis and I will do whatever you want. Okay, at that time, the labs were good. Sounded like a reasonable plan. My doctor was on board. I was on board. We had a plan. And then March happened. So in March, I very suddenly found myself in a fluid overload situation. I went from nominal fluid that was treated with a very low dose of Lasix to suddenly in acute kidney failure, holding fluid. And basically I woke up one Saturday morning. I couldn't walk the 12 feet from my bed to my bathroom. And my husband ended up taking me to the ER. Next day, so in the ER, they did some x-rays, found out I had fluid in my lungs. Okay. Admit me to the hospital. Well, a couple more tests show I actually had fluid around my heart. So now I'm in the ICU. So all this is transpiring very quickly, very much out of my control, very much not according to the plan that had been made a couple months earlier. So 10 days in the hospital, 2 surgeries, left the hospital 3 liters of fluid lighter and with a PD catheter as an accessory. And that was hard. So Lori told you, I'm a professional change manager. in theory, I could tell you the theory of change. I can tell you how people change, why people won't change, all of the academics behind it. But here I am now living through this major change, which most definitely did not go according to plan. It was during the time period that I had spent most of my adult life trying to avoid, where I really wanted the attention focused on my daughter and all of her milestones and achievements. And here everybody was paying attention to me and my health in this emergency situation. It was overwhelming. There were days where I cried. Being in the hospital for 10 days, you don't get any rest. It's exhausting. And then you're coming out and you're going for follow-up treatments. And I remember one of the moments that really got me was the first time I went to my dialysis clinic for a bandage change, and I saw the catheter coming out of my abdomen. And that was very jarring and upsetting. And it was like the reality of the whole situation hit me hard. And then being on disability for 6 weeks and having to take some time away from work and slow down and give my body time to heal and go through dialysis training. All those things were really upsetting. And I found myself in the bottom of that change curve and the pit of the despair for a good couple of weeks, a good couple of months. And then a funny thing happened. I woke up one morning and I felt clear and lucid. And I was walking on the treadmill and I was able to up the speed a little because I felt good. And I started feeling like it, and it wasn't just a one-off thing. It started continuing for a couple of days. And, what I realized was happening was that the treatment was working. So this dialysis treatment, which I had been afraid of, which I had resisted, which I didn't, even with all the knowledge I had accumulated, I couldn't fully process and understand and had resisted. All of a sudden I'm doing it. The toxins are coming out of my body. The fluid is coming off my body. And I feel better. And I've got more energy and I'm clearer and I can function. And I'm like, and it's noticeable. Well, now this isn't just keeping me alive and life support. It's a mind set shift. And now it's letting me live and do and be better. And it's making me appreciate just how bad I had felt previously, right? So it's a whole shift. Instead of losing control, now I've got control back, and I'm feeling better, and this is working. And I was like, all right, this is a bit of an annoyance. It takes some getting used to. I have to do some more planning and things in my day, but the benefits I'm getting from it are worth it. I feel better than I've felt in years. So that kind of brings us to where we are now in my journey. I've been doing dialysis for 6 months. And one of the things we talk about in change management is celebrating the wins, right? And I think that's something to when you're managing a chronic condition, celebrating those wins, those small victories, wherever you can get them. And for me, a lot of those small victories were around being there for my daughter. Yeah, I missed her senior breakfast while I was in the hospital, but I was out of the hospital and able to see her go to prom. I was there for her high school graduation. And the big thing is I was able to take her up for her college move-in, and we made that work. And we took me and my dialysis supplies on the road, and we did the whole college move-in thing, and I got to see her off. And my husband and I tacked on a couple of extra days and spent some time, away, just regrouping and traveling a little bit, which we hadn't done since the year before. And just proving that, okay, we can take this dialysis show on the road and it can work. I continue to feel good. My labs are good. I still have energy for exercise, for work, for managing my kidney disease and my dialysis treatment, which is kind of like a part-time job. And another bonus that I found is because my dialysis is working and working pretty well, I actually have fewer dietary restrictions. So I have a little bit more leeway in my diet when it comes to what I can eat and what I can't eat. Still have to watch the fluid, which is, typically a part of dialysis treatment. But I've got definitely some broader parameters in terms of what I can eat. So I'm managing with it. I'm working the dialysis into my life and not letting the dialysis and my kidney disease be my life, define me, define who I am, define what I'm doing. Definitely have to plan, definitely have to give things some thought. Like, okay, I want to go to bed at this time. I need to back into the prep time it takes to set up my machine and do all the things. And, if I'm packing and going away, there's another level of planning and supplies that have to be considered, besides clothes and toiletries and all that stuff. But overall, it's working, and it's manageable. And, my next steps, I'm still looking for a living donor, and I am looking forward to starting the next chapter of my life with kidney disease, whatever that may be.
Thank you, Kristin. I have a question for you.
Sure.
Suzette, can you take down the slides so we can see Kristin? I'm very impressed with you because you planned so much to have an easy dialysis start. And nobody ever wants to say, I might have to start dialysis. But did that make you feel more in control, like you were doing something? Is that just your nature to be proactive? I know for me, if I feel more in control, it makes me feel less anxious. But sometimes it's hard to pull the covers, over, you want to just keep them over your head and not see anything.
Yeah,
in your case, you didn't do that.
No, I am definitely a planner. I may not be a type A, but a true type A personality wise, but I'm a solid B plus. And I like to plan. I like to be informed. My family and friends will tell you going on vacation with me is actually really annoying because I have things planned down to the hour at times, and they're like, whoa, back off. But in general, I like to plan. I like to be educated and informed. So that's why when, my doctor and I had the plan, dialysis in September, okay, I can get my head around that. And that's why it was such a hard but necessary life lesson for me when I had to do that pivot, and the universe was saying, you know what, we're taking this out of your control. It's going down now, and you're not going to have any control of it. And really, when you're in the ICU and you can't get out of bed without somebody else's help, you're not allowed to eat, you're not allowed to do anything. When you're in that hospital situation, having these surgeries, you're giving up full control. And that was a lesson I had to learn. So despite all my planning, despite all my good intention, the universe had other plans for me. And the big life lesson for me in all this was giving up control, reassessing the situation, and then figuring out how I could get some of that control back.
Right. Well, and the other thing that's really interesting to me is that you managed your kidney function by taking care of your blood pressure and your high blood pressure. Anything that could injure your kidneys. So you delayed kidney disease for a long time because of your proactive ability.
I was having a conversation with my nephrologist this morning. It's a pretty simple equation, right? Follow instructions, live. And I think what makes it easier for me, and Laura, you may have experienced this as well, right? We don't know anything but living with kidney disease. So we've managed these little incremental changes, and some of them might have been bigger along the way because we don't know anything different. Where I think a lot of people are diagnosed with kidney disease later in life as a secondary diagnosis of something else like diabetes. And those changes that come to them are at a point where they're more set in their ways, or where it's just harder to process, or they're more resistant to change. So I think that's a big factor that has helped me along the way too, is I've always had to change. It's always been one thing after another. And first it was the blood pressure meds and the dietary change and the little things. So I think that's part of it too. When you're living with a chronic condition and when you're diagnosed with it early, especially this condition, it's easier to recognize the changes and make those changes because you've been trained to do that your entire life, versus somebody who comes into this condition at a different place, in a different perspective, and you find out your entire world is being overthrown. Everything you know, everything you thought you knew, you have to make dietary changes. You have to start watching labs. All these things that are new and scary and different, you and I just have known from the start.
Well,
So in
you know,
some regards, it makes it easier. Some regards, it makes it harder.
well, and I have to say, you know, living with this illness for so long, it's harder when you're older. I mean, when I was younger, I thought I was indestructible. When you get a little bit older, you're like, oh, I'm a little bit more fragile than, you know, when I was a kid. You know, Kristin, I admire how proactive you've been. You're such a wonderful volunteer and help to RSN, and we're so happy that you're in our network, and we get to learn from you as well because you're very wise.
Why, thank you.
All right, so Kristin, from Sheila, she sent in a question. She said, thank you for sharing your story. What kind of surgeries did you have during that emergency hospitalization that you described?
Yeah, so I actually had 2 surgeries. The first was I had I had a 2-part cardiac surgery. So it was a pericardial effusion where they drained fluid from my heart, and then they also drained fluid from my lungs. So I during this emergency surgery, I had 3 liters of fluid drained from my body, which would explain why I couldn't walk from the bedroom to the bathroom, why I couldn't really breathe. I was in AFib. I had like all these complications going on because of this very sudden fluid buildup. Acute kidney failure. Saw my nephrologist in February. By the end of March, everything just kind of went off the rails, and we still can't exactly pinpoint what happened. The second surgery, a couple of days later, once all the fluid had drained from my system and we were pretty sure I was clear from any potential infections, was to put in a PD catheter so I could start peritoneal dialysis and start managing my fluid and the pulling off of fluid that way. So 2 surgeries in about 8 days, one to get all the fluid off, and then another to, you know, put in the apparatus to allow me to, you know, keep it off.
Do you have a favorite quote or something that you live by, or philosophy?
Yeah, I do. And Cher's going to laugh because she knows exactly where this is going. And Estelle and Suzette are too, because they know this too. Okay, so I am a diehard parrot head. I was crushed when Jimmy Buffett died back in September. And part of the reason because of that is because not just the man's music brought me hours of joy and good memories with different friends and family and stuff, but because if you listen to the words of his songs, many of them provide like thoughtful, thought-provoking things to live by. It's more than just wasting away in Margaritaville. So one of my old favorites is goes from a song about Hurricane Katrina that took out New Orleans, and it goes, according to my watch, the time is now. The past is dead and gone. If it doesn't kill, if a hurricane doesn't leave you dead, it will make you strong. Don't try to explain it. Just nod your head, breathe in, breathe out, move on.
Yep. Well, my saying is, what doesn't kill you makes you stronger.
Right? Same concept.
That's really it. Well, I appreciate you.
Breathe out, move on.
Well, thank you so much. And we'll see you throughout the next 5 days.
You will. Thanks all.
Great. Well, thank you so much. And a shout out to our corporate mission partners for making this happen.